If you're over 45 and wondering about your cholesterol levels, you're not alone. Recent studies show that nearly 30% adults over 75 have high cholesterol, and the numbers start climbing dramatically after age 45. Today, we're going to discuss everything you need to know about high cholesterol, why it becomes more common as we age, and most importantly, what you can do about it. What is high cholesterol? High cholesterol, medically known as hyperlipidemia, occurs when you have abnormally elevated levels of fats and cholesterol in your blood. Think of your bloodstream as a highway system. Cholesterol travels through this system in special protein packages called lipoproteins. There are several types you should know about. LDL cholesterol, often called bad cholesterol, builds up in your artery walls like rust in old pipes, creating dangerous blockages. HDL cholesterol, the good kind, acts like a cleanup crew, removing excess cholesterol from your tissues and taking it back to your liver for disposal. Triglycerides are another type of blood fat that can contribute to heart problems when elevated. The condition comes in two main forms. Primary hyperlipidemia results from genetic factors you inherit from your parents. Secondary hyperlipidemia develops due to lifestyle factors, medications, or other health conditions like diabetes. Why your risk increases after 45. Here's something that might surprise you. Your cholesterol risk doesn't just gradually increase with age. It takes a dramatic jump after 45. Australian health data shows that cholesterol problems double from the 45 to 54 age group to the 55-64 age group, jumping from under 9% to over 14% and continuing to climb. Several factors contribute to this age-related increase. Your metabolism naturally slows down, making it harder for your body to process fats efficiently. Hormone changes, particularly in women going through menopause, can significantly affect cholesterol levels. Many people also become less active as they age, and weight gain becomes more common. Additionally, other health conditions that affect cholesterol become more prevalent after 45. Type 2 diabetes, metabolic syndrome, and high blood pressure often develop during this time, creating a perfect storm for cholesterol problems. The stakes get higher too. Untreated high cholesterol doubles your risk of developing coronary artery disease compared to people with normal levels. At our age, we can't afford to ignore these warning signs. Recognizing the silent threat. High cholesterol is often called a silent killer because most people have no symptoms until serious complications develop. However, some physical signs can appear, especially in genetic forms of high cholesterol. Watch for yellowish deposits around your eyes called xanthelasma, grayish rings around your corneas known as arcus senilis, or yellowish bumps on your tendons called xanthomas. These signs become more noticeable with age, particularly if you have familial high cholesterol. Most importantly, don't wait for symptoms. Regular cholesterol screening becomes crucial after 45. The American Heart Association recommends cholesterol testing every 4 to 6 years for adults over 20, but more frequent testing may be needed as you age or if you have risk factors. Prevention through lifestyle changes. The good news is that you have significant control over your cholesterol levels through lifestyle modifications. Let's start with diet, which represents your most powerful tool for prevention. Focus on heart-healthy eating patterns. Choose lean proteins like fish, chicken, and turkey over red meat. Fish rich in omega-3 fatty acids, such as salmon and mackerel, provide additional cardiovascular benefits. Avoid full-fat dairy products and processed foods high in saturated fat. Eliminate foods containing partially hydrogenated oils, which raise bad cholesterol levels. Instead, use healthy fats like olive oil and canola oil. Incorporate nuts, seeds, and avocados, which contain beneficial monounsaturated fats. Fiber plays a crucial role in cholesterol management. Soluble fiber, found in oats, beans, apples, and barley, can significantly reduce LDL cholesterol levels. Aim for at least 25 to 30 grams of fiber daily through fruits, vegetables, and whole grains. Physical activity represents another cornerstone of prevention. You don't need to become a marathon runner. Moderate exercise for 30 minutes, 5 times per week, or vigorous activity for 20 minutes, 3 times per week, can effectively raise your good cholesterol levels. Simple changes count too. Take stairs instead of elevators. Park farther from store entrances, or take walking meetings when possible. Even modest increases in daily activity contribute to meaningful health improvements. Weight management becomes increasingly important after 45. Even losing 5 to 10 pounds can positively impact your cholesterol levels. The relationship between weight and cholesterol is particularly strong because excess weight contributes to insulin resistance and altered fat metabolism. If you smoke, quitting provides immediate benefits for your cholesterol profile. Smoking decreases good cholesterol while increasing triglycerides and overall cardiovascular risk. HDL cholesterol improvements begin within weeks of quitting smoking. Treatment options and medical management. When lifestyle changes aren't enough, medical treatment becomes necessary. Modern cholesterol treatment has evolved significantly, focusing on identifying patients most likely to benefit from medication, rather than treating everyone to the same cholesterol targets. The current guidelines identify 4 main groups who benefit from statin therapy. First, adults with established heart disease, stroke, or peripheral artery disease. Second, adults with LDL cholesterol levels of 190 milligrams per deciliter or higher. Third, adults aged 40 to 75 with diabetes. Fourth, adults aged 40 to 75 with a calculated 10-year heart disease risk of 7.5% or higher. Statin medications represent the cornerstone of cholesterol treatment. These drugs work by blocking an enzyme your liver uses to make cholesterol, forcing your liver to remove more cholesterol from your blood. Research shows that for every 1,000 people treated with statins for 5 years, 18 avoid heart attacks, angina, or strokes. For people with extremely high cholesterol levels of 190 milligrams per deciliter or higher, maximum statin therapy is recommended regardless of age or other risk factors. This reflects the significant cardiovascular risk associated with severely elevated cholesterol levels. When statins alone aren't sufficient, additional medications can help. Ezetimibe blocks cholesterol absorption in your intestines and can be added to statin therapy. PCSK9 inhibitors represent newer medications that can dramatically reduce cholesterol in people who don't respond well to statins or can't tolerate them. For high triglycerides, especially levels above 500 milligrams per deciliter, specialized treatment is necessary due to the risk of dangerous pancreas inflammation. Fibrate medications are typically used as first-line therapy for severe triglyceride elevation. Creating your action plan. Now, let's talk about creating a practical action plan for managing your cholesterol after 45. Start with establishing baseline measurements through comprehensive cholesterol testing. This should include total cholesterol, LDL cholesterol, HDL cholesterol, and triglycerides. Work with your healthcare provider to assess your overall cardiovascular risk. This involves considering factors like family history, blood pressure, smoking status, and diabetes risk. Your doctor may use risk calculators to determine your 10-year probability of developing heart disease. Set realistic, achievable goals for lifestyle modifications. Don't try to change everything at once. Start with 1 or 2 changes, such as adding a 20-minute walk to your daily routine or replacing red meat with fish twice per week. Gradual changes are more likely to become permanent habits. Create a monitoring schedule with your healthcare provider. Initially, you may need cholesterol rechecks every 6 to 12 weeks to assess your response to lifestyle changes or medications. Once your levels stabilize, annual or semi-annual monitoring may be sufficient. Keep a health journal, tracking your diet, exercise, weight, and how you feel. This helps identify patterns and provides valuable information for discussions with your healthcare provider. Many smartphone apps can help track these metrics automatically. Consider working with specialists if needed. A registered dietitian can help create personalized meal plans, while a certified exercise physiologist can design safe, effective workout routines appropriate for your fitness level and any physical limitations. The bottom line: high cholesterol after 45 is common, but it's not inevitable, and it's definitely treatable. The key is taking action before complications develop. Remember that small, consistent changes in diet and exercise can produce significant improvements in your cholesterol levels and overall cardiovascular health. Don't let fear or overwhelm prevent you from taking control of your health. Start with simple changes like adding a daily walk, choosing grilled fish over fried foods, or switching to olive oil for cooking. These small steps can lead to meaningful improvements in your cholesterol profile. Work closely with your healthcare provider to develop a personalized plan that considers your individual risk factors, health status, and lifestyle preferences. Regular monitoring and adjustments ensure you're getting the most effective treatment possible. Most importantly, remember that managing cholesterol is a marathon, not a sprint. Consistency over perfection is what matters most. Every healthy choice you make contributes to better cardiovascular health and a higher quality of life in the years ahead. If you found this information helpful, please subscribe to our channel and hit the notification bell for more health content specifically designed for adults over 45. Leave a comment below sharing your own experiences with managing cholesterol, and don't forget to consult with your healthcare provider before making any significant changes to your diet or exercise routine. Take charge of your health today. Your future self will thank you for the steps you take now to protect your cardiovascular health and maintain your independence and vitality for years to come.